What is the cause of a second-degree atrioventricular block, AV block, type I Wenckebach, of 2 to 1 block, 2 P waves for every QRS complex, in a healthy patient with no symptoms? Claude, AI? There are a few potential causes of an asymptomatic Wenckebach or 2/1 second-degree AV block in an otherwise healthy patient despite no clear structural heart disease. 1. Enhanced vagal tone. Increased parasympathetic/vagus nerve signaling releases acetylcholine, that hyperpolarizes the AV node. This can manifest as periodic non-conducted P waves resembling block. Often variable relation to triggers like digestion. 2. Electrolyte abnormalities. Low potassium, magnesium and high calcium can diminish AV node conduction by impacting membrane potentials. May come and go. 3. Medication effect. Agents like beta blockers, calcium channel blockers, and antiarrhythmics can also impair AV node function as a side effect. Dose dependent. 4. Sleep state. Some patients demonstrate transient conduction delays manifesting only during deeper stages of sleep when vagal tone surges physiologically. Returns upon awakening. 5. Intrinsic AV node aging. Early degenerative changes can begin causing subtle conduction inconsistencies even in asymptomatic structurally normal hearts. Benign initially. In essence, increased neural input, chemical modulation, or subtle age-related changes in excitability can intermittently impede AV transmission in the absence of irreversible substrates. The lack of symptoms implies conduction still adequate to meet physiologic demands, but warrants ongoing monitoring for progression over time. GPT-4. A second-degree atrioventricular, AV, block, specifically type I, Wenckebach, or a 2 to 1 block, in a healthy, asymptomatic patient presents an interesting clinical scenario. In second-degree AV block type I, Wenckebach, there is progressive prolongation of the PR interval on consecutive beats followed by a dropped QRS complex. In a 2 to 1 block, every second P wave is not followed by a QRS complex, making it more difficult to distinguish between type I and type 2 AV block based on the ECG alone. The cause of such a conduction abnormality in an otherwise healthy individual can vary. 1. Increased vagal tone. This is common in young, healthy individuals, particularly athletes. High levels of physical fitness can lead to increased parasympathetic, vagal, tone, which can slow AV nodal conduction. 2. Medications. Certain medications, such as beta blockers, calcium channel blockers, and digoxin, can increase AV nodal refractoriness and lead to a Wenckebach or 2 to 1 block. 3. Electrolyte imbalances. Imbalances in key electrolytes, such as potassium and magnesium, can affect cardiac conduction. 4. Structural heart changes. Even in the absence of symptoms, subtle structural changes in the heart, not easily detectable without detailed cardiac imaging, could potentially cause AV block. 5. Inflammatory conditions. Conditions like Lyme disease or other less common infections can transiently affect the conduction system. 6. Idiopathic causes. Sometimes, a clear cause is not identifiable, especially in asymptomatic individuals, and the condition may be considered idiopathic, without a known cause. 7. Sleep apnea. It has been associated with AV block, likely due to increased vagal tone during apneic episodes. 8. Genetic factors. In rare cases, there may be a genetic predisposition to conduction abnormalities. For an asymptomatic patient with such a conduction disturbance, it is crucial to rule out any reversible causes, such as medication side effects or electrolyte imbalances. Additionally, monitoring over time is important, as progression to a higher degree of AV block can occur. Regular follow-ups with a cardiologist, including possibly a 24-hour Holter monitor or an exercise stress test, might be advised to assess the stability and impact of the conduction abnormality. Despite being asymptomatic and healthy, it is important for the individual to be aware of potential symptoms of AV block that may develop, such as dizziness, lightheadedness, or syncope, and to seek medical attention if these occur.